Today's focus is leg muscles and the balance of the muscles and how that can affect our back. So ball in a sock, maybe two, so you've got a choice. A small hand towel rolled up is a really, really handy little tool. And then either a roller or half roller and a yoga block, and we'll just see how the time goes and see if I can fit that in. So first of all, we'll do an assessment. So you're going to take your small rolled up towel, roll it into a sort of a mini roller, and you're going to put it across your sit bones on the chair. You want a good sturdy chair. You don't want a chair that feels unstable. So usually those chairs that go around, they're not great options because you move too much. My chair is quite high because I want you to see what I'm doing, but ideally your feet are on the floor. So you're going to put your two sit bones transverse across on the towel, and you're just going to start to gently roll backwards and tuck your tailbone, and you're going into what's called a posterior tilt. You're tipping your belly button backwards towards your spine. Okay, so an anterior tilt is where your belly button rolls forward. Posterior tilt towards the back. So you're just assessing how tight you feel, and you're rolling backwards. You find where you hit a little bit of a block where it might be tight, and then you come into the middle position, and then very gently roll the belly button forward. That's usually the problem range. It causes more compression in the spine. So as you roll to the back, your vertebra, they open up and decompress the spinal cord, come into neutral. As you roll forward, they roll inwards, if that makes sense, and they compress the vertebra and the spinal cord. So if you've got stenosis, if you've got a bulging disc, if you've got spondylolisthesis, where the vertebra shunts forward, then anterior tilts are going to compress and cause more problems. So you're going towards the back and just find comfortable range. So just say that you move into discomfort about 1/4 of an inch, 1 centimetre, come back into neutral, and then you're rolling into your anterior tilt to the point of almost pain and only about 1/8 of an inch, so maybe 1/2 centimetre. And you're just trying to figure out those two ranges. Okay. So you can do these movements in bed even before you get up. If you wake up and you can already tell that your back's not feeling great, you can just lie with your knees bent or legs straight and just do these very gentle tucks towards the spine. And once you've figured out where your pain is in the forward motion, you're not going into that. You're going from neutral and into your posterior tilt. And you're just going to keep doing that for about 20, 30 times. And if you can refine the ability to do this, if you imprint your abs as you do this, you can quite often, here comes the rain again, you can quite often push things back into place that might be slightly displacing, so vertebra or maybe even the disc. So you're just deeply imprinting your abs. If in your brain you can find a place that feels uncomfortable, you can really make it quite a targeted abdominal imprint, using your abdominal muscles to push back anything that feels slightly like it's moving towards the spinal cord. So it's very subjective, it's very subtle, but as you practice this, you can get really good at it. So you wake up in the morning, your back's feeling a little bit stiff even before you get out of bed. You're just going to do these posterior tucks. You're going to use your abs just to see if you can gently massage your spine back into place. So we're just seeing now, how does my spine feel? So then take your little towel out. So we're still in the assessment. So now you're going to go from front to back. You're going to put it underneath between the pubic bone and the tailbone. Start really gentle with this. You've got your two sit bones hanging over either side of the roller, and you're just gently going to drop one sit bone and come back into neutral. Gently drop the other. So you're really working the long muscles of your back, your sacrolumbar fascia, the ligaments of your pelvis going into your low back. There's a whole load of structures here being stretched. So again, you're just finding the point of discomfort, and then you're coming out of it. You're assessing the two sides. So if you think a centimetre, you go towards pain and discomfort and come out of it about a centimetre, you're working micro movements and you're just working within a safe range. So, you know, when you get up, if your back feels a bit tight, you could put the towel on a chair, you could do the posterior tucks on a chair, you could do these, it's like a seesaw action, just to get into the back. So as you're getting used to this, you could drop your left sit bone, left shoulder rotates. It's a little bit stronger. Think Feldenkrais, think 60% range. Right sit bone drops, right shoulder turns. Gentle movements, no strain, no striving, just repetition. So if you did this for a couple of minutes, you can sort of iron out long muscles that are locked up and short and tight. Once you've done a few of those, you could put your hands on your shoulder and you could bring in a little bit more of your torso, your upper body and your trapezius. So remember, these muscles are all connected through the fascial system to the muscles around them. So if you're using the muscles higher up, you're going to get much more stretch through the pelvis, through the back. So I'm doing it quite quickly because I want to get to the legs, but you could stop the video if you see this being replayed and you could take a little bit more time. If you want to advance it, you could come into your Cossack. That's bringing in your middle trapezius. 60% range, no striving, no forcing anything. So you can really feel the long muscles of your back getting a really nice stretch. And then hands on forehead, you're bringing in upper trapezius as well. So I'm doing that quite quickly as an assessment, but you would do this much more slowly, and you'd maybe do at least a minute with each of these positions. Okay, so come back into center. So take the little towel out, and we'll try and find time at the end to reassess and just see how things have improved. So I've been doing quite a lot of work with people this week on quads and getting quite some amazing results for people in terms of really reducing pain. So you've got your ball in a sock, you've got two balls in a sock if you've managed to prepare, and you're one hard, one soft, and just figure out, I'm going to go with the hard one because quads usually like quite a bit of pressure. So if I stand for a minute, the muscles that we're going to look at are the middle quad. Okay, so we've got our inguinal line, which is sort of the line of our pants, or our knickers or our pants. We've got our kneecap. If you measure a quarter of the way down, trigger point 1. If you measure a quarter of the way up in the middle, trigger point 2 for the middle quad. So let's start with that one. So find the line, the inguinal line or the crease. Think of the crease here. You're in the middle, you're coming down a quarter of the way, one hand on the ball, one hand on the hand, and you're just doing a sort of a press and a circle. So you're pushing down and then you're rolling, pushing down and rolling, and just find that active trigger. So this is a universal trigger. I'm just going to take my jumper off, it's quite warm now all of a sudden. It's a universal trigger. So, you know, pretty much everybody on the planet is going to find that this one is quite tender. So you just keep rolling. So this trigger tends to affect our knees. Some of the other triggers refer up into the hip, up into the back. So you can do the roll, you could just press. If you wanted to add in a little bit of a torsional release, you could extend the leg. So the torsional release stretches the muscle as you apply pressure, and that's going to speed up the release. Might make it more painful, so you decide whether you want to go that route. Okay, so how about we do the other side, same place? So we'll keep it nice and simple. So find the crease in the middle of the leg, quarter of the way down. Start by pressing and rolling. Now, quite often when you do these triggers, even though they're universal triggers, one leg will be much more reactive than the other. So that's going to show you probably a dominant leg, one that's compensating. So maybe you've got the hip issue over here or the SI joint issue, and this leg is the leg that's really working hard to try and compensate. You're going to find there's a lot more activity on this side. Still need to do both. A little bit like detective work. You're figuring out what's going on in your body. It's a good idea to have a little book and write things down, because a day or two later you've forgotten and you think, oh, I found that thing that really, really works and now I can't remember what it was. So it's a good idea to scribble things down, and that way you start to build up a picture. So once you've figured out where the trigger is, you could just press ischemic pressure, cutting off the blood supply to the nerve ending for about 90 seconds. You can add the torsional release. So I quite like doing the quads this way because it's not as painful as using the roller or lying face down on the floor with a ball. You're using the arms. You could use a knobbler as well. I know some of you, hands get a little bit tired. So, but really no fingers involved here. I'm just pressing with my palms. It's a little bit of ab work going on as I press. So about 90 seconds. So these are things you could do in the evenings when you're watching television maybe, but nothing else to do while you're watching something. You could just work on the legs. So just keep going with that. And I just want to show you a little illustration. So this is a elastic band around a piece of plastic, but it shows you that, say the top side is your quadriceps and the bottom side is your hamstrings. If we sit for too long, the quads shorten and tighten. So it looks a little bit like a bow, an archer's bow, but you see what happens to the hamstrings in response to that. So the hamstrings lengthen and they lock in a long position, and the quads shorten and lock in a shortened position. So then you've got two muscle groups, two opposing muscle groups that are both in trouble. So you've got short locked quads and long locked hamstrings. Very simplified sort of explanation, but it shows you how sitting for too long can cause a lot of problems with these muscle groups. So then as we go to stand up afterwards, because our quads are short and locked, we're in this sort of position with the bottom sticking out. Then we're walking around, and then the back becomes very unhappy because it can't come back into neutral. So we have to keep an eye on this all the time if you've got a job where we're sitting for long times. Okay, so the second trigger was if you extend your leg, find the top of your kneecap in the middle, a quarter of the way up in the middle, and that's the other universal trigger. So just do press and circle, and just find that active place. Sometimes if you go down the front of the leg, it's slightly outwards of that middle line. So more towards the outer leg than the inner side, and just slightly outwards from that midline of the front. So I found mine now, I've gone off the line. So just find what's tender. So the pain referral for this muscle group is usually into the knees. So if you're going up a step or down a step and you get painful knees, you look at this middle quadricep. These are the master triggers. I'm going to do the torsional release, but you can find the satellite triggers all the way along the front of the leg. So anywhere down the front of the leg there can be triggers, but these are the major ones. So this one for me is really, really sore. So you find your 6, 7 out of 10. You're breathing. Maybe torsional release. So if you wanted to check for the others, you could just come down the middle of the leg, rolling the ball. I'm holding the end of the sock. That's why the sock is handy, because it stops the ball escaping and rolling away. So for me, it definitely was the master trigger. So I'm just going to come back to that. So anything up to about 90 seconds. And if it still doesn't come down, then maybe you would try your roller, or you just leave it and try it again later on in the day. So other leg, quarter way up of from the top of the kneecap, find the kneecap, quarter of the way up, slightly outwards, very slightly out towards the outer line of the leg. You're still on the center, but slightly off the line. And then just finding anything that feels a bit tender. So quads might not offer up their trigger point straight away because they're quite deep, dense muscle. But I can feel straight away that this side isn't as reactive as this side was. So now, after about 20 seconds, I can find the trigger. The muscle's relaxed enough. You can add in your torsional release if you want to. I'm going to stay just with the leg down. Keep an eye on the time today because I've got an awful lot to get through. Okay. So then if you come back to the other side again, come down from the crease to the quarter of the way down, but then move a little bit further out, maybe 2 or 3 centimeters out. There's another quadricep here. So just roll the ball around until you find anything that's painful. So you come up the center line, you're 1/4 of the way down from the inguinal crease, 2 or 3 centimeters outwards, and just see here. Now this one refers pain up into the hip. So hips was one of the things we were going to focus on today. I'm holding the end of my sock so I don't lose my ball in the sock. So again, this one is quite tender for me. So this is your medialis, vastus medialis, which is one of the 4 quadriceps. So it starts up here, but then it comes down towards the inner part of the leg. So we're just, so they sort of all overlay each other, the 4 different muscles that make up your quadriceps. So the other trigger point for this one is about 1/4 of the way up, but on the inside of the knee. So you could just try it there and just see. So this one hurts as well. So you've got your point of origin is at the pelvis, and then it's coming down to its attachment at the knee. So these can all cause knee issues, but also this one is sending pain up through the nervous system into the hip. So we talk about hip muscles, but there's actually 25 muscles that come into the hip. So that's an awful lot of muscles to check. So it's very difficult to say there's one hip muscle because there's so many. The tensor fasciae lata, the TFL, is the main one to check. We'll get to that one in a minute, but these are all the others as well. So we've got adductors, we've got quadriceps, we've got hamstrings, we've got the IT band, we've got hip flexors all coming into this place. So try the other side. So you've got the inguinal crease. You come down 1/4 of the way, and then you're moving out 2 or 3 centimeters, and just move the ball around, see if you can find anything. Yes, this one's even worse than the other side. So it's interesting how the story changes from side to side. So for me, this is definitely a compensating tight muscle. And sometimes if the triggers are active, you're going to notice these muscles feel quite fibrous and knotted up. So instead of a nice smooth tone to the muscle, you can feel that you're going across layers of strata, tight bands of muscle. So as the triggers fire up, the muscle distorts, the blood flow changes, the lymphatic flow changes, to the point where you can actually see these taut bands in the muscle if you used MRI imaging. So for me, it's very, very tight through here. So that's trigger point 1 for medialis. And then the other point to look at is 1/4 of the way up, but on the inside of the knee. And just see if there's anything going on there. So the nice thing about these releases is you could do them just sitting in a chair when you're watching television, so that if it's something that's easy to do, you're more likely to do it, whereas getting the roller out and finding a bit of time to do a half-hour session is a little bit harder. But this is something you could do on a regular basis just when you're relaxing. So this one is painful for me, but not as painful as the other side. So you sort of look at how the muscles react and how it jumps from side to side in the body. So the body is one entity. You can't divide it into bones or muscles or ligaments and tendons. It all is just it's really a unit, an entity that absorbs tension and forces. So we're looking at how the forces are moving through the body and how that's setting us up for injuries and pain. So that's the medialis. So then one of my least favorite muscle groups is the vastus lateralis, which is on the outer side of the leg. So if you went from the outside of the knee to the greater trochanter, that's going to be your iliotibial band. But if you look at my pants, it's slightly in the black shaded area, moving slightly inwards towards the middle line, is your vastus lateralis. And your vastus lateralis, it grows into the IT band. So if you hold your sock and you come into, divide the outside of your leg into 3 zones, 3/3, you're in the middle zone, and there's 1, 2, 3 trigger points in that middle zone. So, anywhere along through that middle section of the outer thigh. So this is quite a nice way to do vastus lateralis. If you do it with a roller, it's actually quite painful. And if you do it in the mermaid, it's going to be more painful as well, a little bit more targeted. So you're just sort of finding anything that feels tender. So you've got 1, 2, 3. So if I turn my leg to the side, 1, 2, 3, through here. So for me, very fibrous, very tight. I would say all 3 triggers are a little bit unhappy. This is a very common one because the TFL, which is the universal trigger in the body, it goes down through the IT band and into vastus lateralis. So these 2 muscles are very much affected by each other. Every time we lift one leg off the floor, this muscle group has to stabilize the hips. So very connected to hip pain. And now, after 20 seconds or so, I can really find those triggers. At first, it felt like there was no problem at all. So definitely issues here. So these muscles are going to keep on tightening up because we walk. It's not a quick fix when you're doing leg muscles. It's usually the 2 extremes that cause active triggers. So sitting for too long and then long walks. So inactivity and extreme activity is going to set you up for trigger points in the legs and the hips and the back. So we don't want to be too immobile, and we don't want to be too active. We want to find a happy medium, and little and often is better than just going once a week for a really long bushwalk. That's not going to be great after you've been sitting at your desk all week. So you sort of have to try and find ways to manage these issues. So try the other side. I'm turning sideways so you can see. So you've got the outer band from the greater trochanter, the hard bump at the top of the leg, to the outside of the knee. 3 zones. You're in the middle zone and you're slightly moving inwards from that lateral line. So you've got your iliotibial band, and then your vastus lateralis is slightly higher than that if you're looking from the side view, in the middle. So for me, again, I can feel active triggers straight away. The other side, it took a while to find them. This side is unhappy. So, you could use a knobbler here as well. So I've got and you could add a little bit of torsional release as well if you want to. So because this one is so nasty, I'm just pressing, I'm holding, And now I'm adding in the torsional release. Now the argument is, and I tend to agree with this argument, is that stretching leg muscles is really not productive at all. It gives you temporary relief. Using trigger point work gives you quite a good release, but the best thing when you're dealing with hips is to really work the whole group, all 25 muscles in certain movements, so that you strengthen the weak ones, you relax the tight ones, and you bring the group back into balance. And I think that's probably the best way to deal with hip issues, SI joint issues, back issues. So I'll show you the hip protocol in a minute after we've done the legs. So we're just seeing what sort of relief the trigger points. Remember, you've got 1, 2, 3, slightly away from that side band, slightly inwards, and you're just checking them all. Okay. So we've done both legs. So now the hamstrings. The hamstrings, you're going to get a fairly hard ball. You're going to come in front of the sit bone, and you're going to just allow the pressure just to talk to the muscle. So you've got a middle hamstring that comes from the sit bone to the back of the knee. Torsional releasing at the moment seems a little bit too strong for me, because this one is quite active for me. A good idea if you're doing a job where you're sitting for a long time is to get 2 soft balls and just put them in front of your sit bones and just periodically sit on them. So that as you're, if you did it for 5 minutes while you're typing or something, it'll just relax the hamstrings so that they don't get too short and tight or too long and tight over the day. So little and often is a good way to go. So that's quite a nice tip. You don't need to do it all the time, but just for sort of 5-10 minutes every now and again. And you're coming down the middle of your hamstrings. I've done other tutorials just on hamstrings where you can add in a little, spend a bit more time and do some movement as well. But all I'm doing is just extending the leg. I'm keeping my shoulders over my pelvis. So I'm in a fairly neutral spine. Coming down the middle. I'm doing about 10 leg extensions, and then I'm moving down again, and I'm coming down, sort of a hand space each time. So this is your biceps femoris, which means it's just got 2 heads to it. So, you could put 2 balls in a sock and come down the back of the leg. That would be quite a nice way to relax these muscles. So remember what we said about the quads going short and tight, and when that happens, the hamstrings go long and tight, and they lock in a long position, which means your back is really, really not very strong, not very stable. But they do that as an adaptation to try and protect your back. So it's, it's a good idea to keep an eye on these muscles. So I'm coming down again, about another hand space, about 4 fingers down. For me, it's getting easier as I get towards the knee. Sometimes it's the other way around. So thinking before we get to the knee, if you put your hand in the back of the knee, it's about 4 fingers. You never go into that space. So in this space, you've got lots of muscles attaching from the calves and from the hamstrings. You've got blood vessels, you've got nerves. Sometimes there's varicose veins in there and cysts. So you're staying away from the back of the knee. So if you put your hand in the back of the knee, the lowest you would go with the ball would be just above your little finger. So just see how that feels. Make sure you can still fit your hand into the back of the knee and still feel like that space is protected and safe. Okay, so come to the other side, just in front of the sit bone. So this is the origin of your middle hamstring. And interestingly for me, it's not as tight on this side. So again, the orientation of your pelvis, could be leg length discrepancy, could be a whole load of reasons why one side is tighter than the other. And this side I can extend the leg. The other side I didn't feel like I could because it was so tight. So you're just writing these things down in your little book. It might change, it might not be a constant, but it just starts to give you a bit of a picture over the weeks that you start to think, okay, this is my pathology, this is what my body's doing, and you know better then how to take care of it. Try and be a little bit scientific. So then you're coming down about 4 fingers down the middle of the back of the leg. So just doing the quads and the hamstrings, the minute you stand up, you're going to stand up a lot taller, a lot straighter. Your pelvis will come back into a much better orientation. Your back will immediately start to feel a lot better. So about 10 extensions, and then you're coming down again. So this leg is opposite to the other leg, and I'm just describing these things so you think about them. The other leg was more tender at the sit bone. This one is getting more tender as I move downwards towards the knee. So there's something slightly different going on in my 2 hamstrings. So measure your hand behind the back of the knee. So don't go into the back of the knee, but where your little finger is, just above that little finger, is the lowest point that you'll go to. So just check your hands behind the knee. You're nowhere near the back of the knee. You're just on the muscles. You're staying away from delicate structures that can't handle the pressure of a ball. So certain places in the body like armpits, groins, back of knee are places that you don't go, and also the blood vessels at the front of the neck. They're the 4 main areas that you have to be careful. Maybe the 5th area would be sort of be very gentle in the abdomen as well, because we've got large arteries and blood vessels in the abdomen as well. Okay, so that's the middle hamstring. So if you go back to the other side now, anywhere, if you put your hand at the back of the knee and then come up, sort of hand space up, anywhere in this area, on the inside and the outside, you've got lots of diffuse trigger points. So I've got 2 balls here. I'm going to put one on the inside, one on the outside, and I'm just going to use the pressure of the 2 balls. I'm going to hold them there with my hands. I'm just going to swing the legs so that it just works that area. And as I'm doing this, I can feel that I'm a little bit more tender on the inside of my knee. This is an area you might need to be careful if you've got any varicose veins. So varicose veins is a contraindication for trigger point work. You don't put a ball on an area where you've got varicose veins. So, you know, you might have to miss this area out if you know you have got damaged blood vessels. You don't want to assault those blood vessels and cause any injury. So then try the other side. So I'm doing this quickly now, but these are areas that if you watch the video again, you could come back to this and you could just stop the video and then you could spend a bit more time here, just to jog your memory. And this side doesn't feel too bad at all. So we've got 3 muscles that make up our hamstrings. We've got 1 in the middle. We've got 1 coming towards the inside of the knee, 1 coming towards the outside of the knee. So, and the triggers all tend to be in that lower third for the outer and the inner ones. So sort of anywhere here. So I'm just doing this as a sort of a 20-second check, because I know that I can tell by the way it feels that there's no problems for me here. So once you've done that, if you just stand up, you'd feel immediately, you'd feel a little bit taller and a little bit more comfortable. So we're going to do the TFL, which is if you put your hands in your jean pockets. TFL is slightly between the front of the pelvis and the side of the pelvis, and it comes down into where the black shaded area is of my pants. So it comes down into your IT band and your vastus lateralis. But the triggers are all up here. So you've got 2 triggers, 1, 2, in the deep muscle. If you extend your leg and turn your toe in, you'll feel this muscle. So your leg can be straight and just turn your toe inwards. You'll feel the TFL tightening up as you turn your toe in. And you're going to choose whichever ball. I'm going to go with a soft ball. And I'm just going to go against the wall. So ball in a sock against the wall, and you can just pin the ball into the wall and then just roll across that. If I show you with my other hand, just roll across that front of the pelvis, from the front, from the ASIS towards the above the greater trochanter. So there's 2 triggers, and as you roll, you're going to hit both of them. If you find, you know, one that's really, really painful, just stay there. Just watch what your spine is doing. You don't want to be doing something odd with your spine and making your spine unhappy. So I'm lifting this knee up. So you could do a little bit of torsion by moving the knee that's closest to the wall. You could swing the knee. These are really quick ways. A little bit brutal with the ball because the ball is so targeted. So what I've noticed now is now the muscles relaxing, I can really find those triggers and they are quite unhappy. So this is the universal trigger in the body. So most important, or 2 triggers here, most important part of the body to check. So again, TFL fires up because of inactivity or extreme activity. And going from one extreme to the other is usually a surefire way to make this muscle group quite unhappy. You can stretch this muscle, but it's not going to make any difference. It's not going to last. So doing the trigger point work, now I'm rolling, really rolling from front to back, feels quite nice. You could go up and down a little bit, but really it's more front to back for this muscle. You can do this on the roller as well. So when you've done one side, do the other side. So remember, imagine where your hands go into your jean pocket. If you're not sure, you just turn your toe in and you'll feel the muscle contracting, and then you're going into it. I'm holding the sock. I'm bending the knee that's nearest the wall. I'm giving myself a good 20 seconds because this muscle group is not going to just say, hello, here's my trigger point. It's so deep and tight. It's going to really resist this until eventually the muscle softens. So now, 20 seconds later, I can really feel this side is much more unhappy than the other side. Feels a little bit electrified, a little bit nervy, and that's a surefire sign of an active, irritated trigger point, is when you feel that sort of sharpness. You can swing the knee, you can lift the knee, swinging. So it just helps to move the muscle while you're releasing it, so it speeds it up a little bit. You could easily spend 5 minutes on this muscle group, and then you'd notice, you know, everything's feeling so much better. Just a little bit longer, so we do the same as the other side. So we started that with the ball, but now we're going to come onto the floor with the roller and do it again with the roller. So a little bit more comfortable with the roller, but just really making sure that we hit this muscle. So you're coming onto your elbow. Straight legs is going always to be a little bit more direct. If you bend your knees and put your knees on the floor and you're rolling, that's a little bit more comfortable because the muscle will be more relaxed. So as you straighten your legs, there's more tension in that muscle, which means it becomes quite a torsional release. So you can go up and down the side of the pelvis, you can roll front to back. So front is TFL, middle is glute minimus, and the back is glute medius. So roll is this is one of my favorite releases because it does do 3 major groups all at the same time. So the glutes attach into the hip as well. So we've got quads attaching into the hip. We've got the side muscles attaching into the hip. We've got the glutes attaching into the hip and the hamstrings. we've got the adductors coming into the hamstrings, and then we've got our hip flexors coming into the hip. So there's your 25 muscles that you would need to sort of have a look at. TFL on the roller, if you bring your top knee onto the roller, it turns you into a half turn, and that puts you directly on your TFL. You put your knee on the floor, you can do circles with your foot, you can extend and flex. That's just going to really get the muscle moving as you release it. Mine feels a lot happier because I've already done it with the ball. If you did this without doing the ball first, you might find it's quite painful. So then, just to transition, let's just do the front of our quads. Make sure you're pulling your belly button in. You can bend your knees if you want to make it a little bit more of a torsional release. So even just, 10, 20 strokes on the roller, and you're going to really help to relax your middle quadricep. And push back into knees. So that was just a really quick look. And then change sides. So back to TFL on the other side. So the easy way is with your knees bent, make sure your elbow is under your shoulder so you don't put too much stress into the shoulder. You're rolling up and down the bone at the side of the pelvis. So you can feel lots of muscles here. Really tight muscles. If you take the legs into straight, there's more torsion in the muscle. And now I'm rolling front to back. Up and down. Front to back. Up and down. So flipping over onto our front again. Do the quads the second time. Maybe bend the knees. Do about 10 strokes. Pull the belly button into the spine. And back onto our knees. Sitting into our heels. So just give yourself a moment. Just stretch, see how things feel. Come back up. So grab one ball in a sock. We're going to do this super quickly because I don't want to run out of time. I want to have time to do the assessment. You come into the mermaid position. Put the ball halfway down or as high up as at the side of the leg as you can, and just pressing into the knee. So this is going to work your IT band, your vastus lateralis. So remember the main triggers are in that middle section if you divide the outside of your leg into 3 zones. But really, any of this line, you can find triggers. So this is a good way to get into your vastus lateralis. So vastus lateralis, TFL, they feed pain up into the hip. They affect your knees, affect your walking. The other group I forgot to mention for the hip attachments is also your rotators at the back of the pelvis as well. So you've got your piriformis and the other small muscles that all have influence in the hip. So it's quite a lot. So you're coming down, just pressing. But you could just do this as well. You could pick out your favorites. If you didn't like doing it in a chair, you could do this, just bypass the ones where we did it with the hands and just come straight into the mermaid. The mermaid is more effective because you can press. And also while you're doing your mermaid, you can get a second, if I can reach it, here we go, a second ball, and you can be doing your quads again. So you can sort of double up on that inner quad towards the knee. You can do your adductors. which are all part of the muscle groups that come into the hip. So you spend more time here and get a little bit creative and just work on these muscles. So I'm mainly focusing on the ones in the middle of the outer side of the leg rather than all the way down. But if you've got more time, change sides. You can do all the way down. So again, for me, this side is a lot more uncomfortable than the other side. So the pain is jumping from side to side depending on the muscles. This is where it's good to keep notes. Just breathe. Looks like the weather's clearing up a little bit now, which is good. I think we might be through the rest of it. So coming down. And one more. So I'm staying in that middle third, just to get to the worst of the triggers here. So like I said at the beginning, stretching really doesn't work on relaxing these muscles. It's temporary. Using your trigger points does bring about huge relief and change in the muscle. But when they're talking about hip strength and flexibility and mobility, movement might be the best approach to look at the whole group. So often we're weak in our hips, and that's also a problem. It's not just tightness, it's imbalances, it's weaknesses. So come to standing. Turn your chair towards you so that you can use the back of the chair for balance. Okay. So the movements, I'll just list the movements. You've got 6 movements for the hip, and I'll describe them as you do them. So you're holding the chair and you're working the outside leg. So the first movement a hip should make is flexion, to bend. The second move is adduction, which means to move towards the center of the body. You can extend the leg down and you get a bit of a stretch through your TFL. Come back into flexion. You're going to go into abduction, which is to move away. So to abduct means to take away from center. You're going to go into internal rotation. You're going to go into external rotation. You're going to keep the knee high as you go around towards the back. And I'll turn sideways to show you this one. You're going to take the leg into extension, hip extension. You don't want to move your body forward to avoid that movement. So keep the shoulders over the hips, tight bottom, and go back until you feel a bit of a stretch at the front of your hip. Come back into flexion. We'll do that in reverse. We go back into extension without moving forward. We'll bring the knee around high and come back towards the front. I'll turn to face you again. We're going to go into adduction towards the center of the body and stretch. We're going to come back into flexion. Abduction is to move away. We're going to go into internal rotation. Just find what's comfortable for you. External rotation. Keep the knee high as we come around, so you feel quite a stretch in your hip. Come into extending the hip, so extending and taking in a long, there should be a long line through here, into flexion. So do that again, go into extension. Don't let your upper body absorb that movement. Bring the knee around and high towards the front. So we're doing it 3 times. So adduction, moving towards center and stretch. Come back into flexion. Here's the cat doing his appearance to the video. Abduction is to move away from center. We've got internal rotation of the hip, external rotation of the hip. We move the hip around in that high position and we come into extension, into flexion, and take the foot down. So if you do that protocol, if you watch this video again, do that protocol up to 5 times, you're going to really stretch tight muscles, strengthen weak muscles, balance those 25 muscles. You'll keep your hips nice and strong and healthy. Change to the other side. So outside leg, hand on the chair, outside leg into flexion, Adduction, moving towards the center of your body. Try not to move the bones of your torso and stretch. So you feel the muscles through the TFL stretching. You come back into flexion. You're going to abduct, take away from center. You're going to internally rotate the hip, externally rotate the hip. Keep the knee high as it comes around. Just let your hip navigate that, however it feels right for you. I'll turn, you extend your hip, so there should be a straight line through here. Shoulders should still be over hips, bottom tight, coming into flexion. So go back into extension without changing your torso. Come around in the highest position, no, that's my chair there, highest position that you can, and then we do it again. Adduct, don't let the torso move, stretch. Come back into flexion, abduct, take it away. Internally rotate, externally rotate. Keep the knee as high as you can as you come around, and then move into extension, into flexion, come around. Oh, sorry, go back into extension, I missed one out. High knee comes around. So one last time, adduction and stretch. Come back into flexion. Abduct and move away. Internally rotate. Externally rotate. High knee comes around. You're moving into extension. You're moving into flexion. And take the feet back down. So that's a really nice protocol for your hips. You should feel nice and stable, nice and balanced. So we're coming back to our chair. I don't think I missed anything out. No, I think I managed to get everything in. So come back to the assessment. Grab your little towel. So again, you roll up your little hand towel. So it's going to go transverse. It's going to go across from sit bone to sit bone. You're going to sit on it. So when you do this, you want your feet, I've got my feet on the little bar there, but you want your feet on the ground. And you're just going to come back into that posterior tilt, belly button towards the spine. Let your pelvis drop over the roll towel. And how does your back feel now? Mine feels a lot better. So as you do that posterior tilt, try an anterior tilt, but stop just before you move into pain. So if there's any discomfort, any tightness there, if you've got disc problems or spondylolisthesis or stenosis moving forward, you might get that pain. So you move just towards it, but not into it. So you're rolling backwards. And as you roll backwards, you're imprinting your abs strongly. So you would build up, 20, 30, 40, 50 of these. So if you have got a vertebra that's shunting forward, doing these movements will just push it back. If you've got a bulging disc, it's decompressing the disc and allowing it to, sort of go back in a little bit. So as you roll backwards, you're opening the vertebra towards the spinal cord. So the spinal cord's here, you're opening the vertebra, decompressing the vertebra of your spine. If you go into belly button forward, you're pushing in towards the spine and you're putting more pressure into the spine. So you've got to be careful on going forward. So take the towel out, put it across from pubic bone to tailbone. And just let the sit bones sort of hang either side over the towel. And you're going to start by just dropping that right hip, dropping the left hip. So now you're really feeling those lumbosacral muscles, ligaments, and fascia. So this for me is much more comfortable now. So as you get used to that, as you drop your right sit bone, take your right shoulder into a bit of a twist. And then come back. So right sit bone down, right shoulder gently turns. I think 60% range. Low effort, no striving, just using gentle repetition. You're bringing in the whole of that right side, from the skull to the tailbone, all of your muscles of your back. So then maybe drop the left sit bone and let the left shoulder gently turn. Find your 60% range, whatever that is today. Be careful of your neck. Some of you will be neck dominant and your head will be turning way too far, and that forces your spine to follow the cervical vertebra. So sort of keep your nose lined up with your breastbone, and that way you're reining in those dominant neck muscles. So if that feels okay, you can go to crossing the hands on the shoulders. And now, as you do the right hip drops, sit bone, you can feel as you twist towards the left that you're bringing in your lower trapezius. And these muscles have got great influence in the spine. The trapezius goes from the neck to the bottom of the rib cage, but is connected through the fascial system into those long back muscles. Again, so we're just doing one side, we're not going right, left, that's a little bit too much. So then drop the left sit bone and twisting the other way. And keep it at your 60% range. Keep your nose lining up with your breastbone. If you're on a tighter side, then your 60% will be reduced to a comfortable range. You might not be going as far. Keep it safe. You can't force back muscles to relax. You've got to coax them into relaxing. So if you're okay with this, we'll do one more. Then you come into your Cossack, which is your middle trapezius, sort of between your shoulder blades. So you can feel you're working higher now, up the back. Nose lines up with the breastbone, don't let the head do its own thing. And then going towards the left sit bone dropping, moving towards the right. Again. And then finally, hands on forehead, upper trapezius, and this is coming up in towards the shoulders and the neck now as well. Other side. And maybe even doing this, you found a few extra places that might need trigger point work. So for me, definitely around the shoulder blades, you know, it's pretty tight, so you could sort of go there next if you wanted to. One more. We're nearly there. Take the hands away. So just putting your hands under the chair, just come into a mermaid and drop your right sit bone and gently stretching up and away through the right arm, and then come to center, and then dropping your left sit bone, left arm. So you can go side to side when you're sure that the muscles of the back are happy. It's safer to do just one side if you think the muscles are a little bit irritated and you need to be more careful. Try not to, I just did it myself, try not to swing. So make sure the hand is under the chair before you lift the other arm. So we tend to get into swinging, which is not good for the back. So be more mindful, use more control. That's one of these. And then finally, now we know that our back is okay, we could do a mermaid and we could add a spiral. We could look behind. That's an advanced mermaid. So we're doing the mermaid and we're spiraling to look behind. So now we're allowing our head to take our spine even further into rotation. So you drop the sit bone and you spiral and look away. Drop the sit bone, spiral and look away, and come back into center. take the towel away. So that's a little bit like going to a spa and having a back massage, except you did all the hard work yourself. So that is how the leg muscles can affect the back and the hips.